Room, the only way to start your day.
I couldn't let it go.
I shall be.
You shall be resuscitated.
I want mine to beat for you.
There's a doctor in the house, so all of you with problems this morning, this is where to come, because she can help you get it beating again.
Okay.
For those of you with broken hearts, maybe she can put it back together. And those of you who think you're not quite sure if it skips a beat, we'll see. Speaking of which, by the way, did you know I have an extra heartbeat? And they told me that, it's subtle, but I love with everything. They told me that it's not going to hurt anything. It's not going to hurt anybody. Maybe you can tell me if it's true or not. And who is this who might be telling us these things? A Healthy Friday conversation today is with Dr. Barbara Karau, and she's a consultant cardiologist at the Aga Khan University Hospital, and joins us on A Healthy Friday. Good morning, Dr. Ari.
Good morning. Happy to be here.
Happy to have you. You can see we're already giving you a lot of work to do even before you know what is what.
I think I need to take out a notebook and start writing these things down.
Everybody has heart problems in one way or another.
Yeah.
Let's get into the conversation. And even as we do, Dennis is going to welcome you with today's proverb. We'd love to get your interpretation of it.
Yes. Our proverb comes from Cameroon. So it's a country that is rich in oil, cocoa, coffee, timber, and cotton. Population of around 28 million people. Football, I talk about Samuel Eto'o, Roger Milla, Indomitable Lions. Big Africa Cup of Nation, right? But let's go to the proverb. If you marry a beautiful woman, you must build a high fence. How would you interpret it?
In the context of life or the heart?
Whichever way. Your interpretation is always right.
Wow. Okay, so I think there's truth to it. Mm-hmm. But I also think, depending on how it is that we are cultured in our society, you may not need it. Everybody is beautiful in their own way. So I think there's, depending on which side you're sitting on, I'm one of those people who I'm going to sit on the fence on this. You may either decide to do it depending on the kind of society that you have. If you don't, then uplift your society and, bring those fences down.
Well,
bring the fences down. Have you heard all of you who are constructing fences?
But we should choose to sit on that fence.
I love the thing about these interpretations. Dr. Johnson says hello to you. He says that you were classmates in Chiromo 1 and 2. You know Dr. Johnson?
Yes, I do.
Yes, okay. He says hello.
Okay.
So now we're in good company.
Yeah.
He has assured us. All right. Let's get into it. So we'll start with a story, as often people did. And it's a true story in this case. A young boy died a couple of weeks ago. Yeah. And the post-mortem revealed that it was a heart attack, or that his heart stopped for some reason. Interestingly enough, he had gotten to school late for whatever reason. Those circumstances really don't matter at this point. But he had gotten to school late. But the fear of what was going to be done to him by his teacher, who students had gotten in trouble with previously, was enough for him to freeze. And the post-mortem said that his heart literally stopped. This boy died in a Kenyan school. We're not talking about a book that somebody read somewhere.
Yes.
This happened to a young boy who this imminent fear and danger of what would happen to him because he was late to class was so strong that, according to the post-mortem result, stopped his heart. Crazy.
Very, very, very.
What could have happened in that particular situation as we get into this conversation?
Very, very unfortunate. School should be a place that children should not fear to go. I mean, this is a place where they spend a good chunk of their time. It should be a safe environment. So the fact that, a child is terrified to show up in school because of repercussions is very unfortunate. The fact that he also lost his life, may he rest in peace, is also very, very sad. So usually when you have situations like this and you have a confirmed post-mortem that actually shows what the mechanism or the cause of death is, you sort of want to understand whether this young boy had ever reported any symptoms that would suggest he had anything underlying. Because many times when people die suddenly or get a cardiac arrest, because that's what this was, there's an explanation or there's a reason or an underlying condition that predisposes them to having the heart stop. Very rarely we have situations, there's a condition called broken heart syndrome. So you can get a mix of things happening, and you get a lot of adrenaline surges into the body. So your heart rate spikes, your blood pressure goes crazy, and your heart can actually stop as a result of the abnormal heart rhythms that occur within this environment. So that broken heart, if it occurs in the context of an arrhythmia, because that's what ultimately makes the heart stop, is a different scenario from a heart attack. A heart attack is a blockage within the blood vessels of the arteries of the heart, or it's a plumbing problem. So the blood vessels can get blocked. Mainly, we know what heart attacks occur due to. You have a cholesterol accumulation over a good number of decades. And then this then causes narrowing, progressive narrowing of the arteries. This then causes impaired blood supply to the muscles of the heart. And then ultimately you get heart dysfunction, and then you get other issues culminating in a cardiac arrest. Excuse me. So when you have a confirmed postmortem that says heart attack in somebody who's young, you don't really expect that to be the mechanism. There are other causes of blockages within the arteries of the heart. For example, you can get a tear within the lining of the heart, and unfortunately, in the process of trying to repair this tear, there's a clot that forms within that artery, and when that clot becomes too big and completely shuts off blood supply, then that, I suspect, may be the mechanism that would explain why this young man had a heart attack. So it's something called spontaneous coronary artery dissection. We abbreviate it as SCAD. There are many other causes that can happen in other patients that can also explain narrowing within the arteries of the heart, but typically those two tend to be the most common.
Well, Dr. Hari, a lot of stories are told about human life and how to stay alive. And one of the things is that your heart has to be beating. We say beating, pumping the blood, so that you're able to function as a human being. But as opined by yourself and that this young boy may have had, perhaps, we don't know. Maybe there are some preconditions that had existed before this, or it was just something spontaneous. But generally speaking, how would we describe a healthy heart or functioning of the heart, such that when now we're able to identify dysfunction, an anomaly, you could tell, maybe through test or assessment, that this could lead to cardiac arrest, heart attack, and all that. But generally, how would I know, as a person who maybe have not yet gone for a test, or what are the expectations from a practitioner like yourself, that this person has a functional, fairly healthy heart system? What would be the indicators that, yes, you're functioning accordingly? And this would be the things that if they stop happening or they start happening, then you could be getting into a crisis.
Okay, all right. Yeah, that's an excellent, question. So it always starts with how you feel. So normally we are vile tumeumbwa. Everything should be working in sync. You should not feel a thing. I should be able to take a breath. I should be able to if I want to stand, I should be able to stand. So things should work in sync, and that's how we've evolved, and that's how we were created. So when a heart is working normally, there's two main mechanisms. So we have an electrical system, and we have the muscle, which is the biggest chunk or the biggest part of the heart. So the electrical system is the one that sets off everything. So it's a controller within the heart. So there's a pacemaker, which is situated in the right upper chamber, that is surveilling, and it decides, okay, the heart is empty, we need to do this so that we can fill up. Then it detects when the heart is full, and then it signals that the heart now is full and we need to pump this blood for the rest of the body. So that natural pacemaker is everything. When we are determining whether or not this person or a person has a normal functioning electrical system, there are simple tests that we can do. One of which is an EKG or an ECG. So this looks at the pattern of the waveforms coming from the electrical signals. So there's what's normal and there's what's abnormal. So that's a good way to determine whether or not the electrical system is working. Then when you're looking at the muscle system, as long as you're functional, we're assuming everything is fine. But if you start to report symptoms related to the heart, which we shall describe shortly, then, that prompts for further testing, because an EKG is the most basic. So the next step would be to examine someone's heart, because sometimes you can pick up abnormalities. This would be in the form of extra heartbeats. Or don't worry, I have my stethoscope. The other thing you can also pick up is murmurs. So these are extra sounds as a result of very turbulent blood flow across valves. Then once you finished your examination, you then do a specialized ultrasound called an echocardiogram. So this is very good in that it tells you what the heart structure actually looks like as well as its function. So the things that you're looking for within the structure is the muscle normal? Is it thickened? Which can also happen in like young patients. You've seen like footballers who suddenly just collapse on the field. Yeah. So when you have very thickened muscle that, can easily be picked up on this ultrasound. The other thing that we also look at is pressures. Anyway, there are very many things that we look within this study to be able to tell whether or not there's normal function versus abnormal function. So in a nutshell, that's what we look for. When it comes to heart symptoms, heart-related specific symptoms, the first one is chest pain. You should not feel pain. So if you feel pain and we think that this pain is related to the heart, the kind of things that we are looking for is the duration of the pain, the location of the pain, what triggers the pain, and the character. So usually heart-related pain should be on for about 5 minutes or so. So pain that comes for a second and disappears is probably not anything serious.
Okay. What could it be? Sorry, Doc. If you have that, because we've heard it many times. Pain in my chest, but then it disappears and then you forget about it. In the moment, you think, "Oh God, I'm dying." But then after it's gone, and then you don't ever feel it again. What would be the cause of that particular thing?
So is it just a heartbreak? But
is it a what?
Heartbreak.
That's a good one. So any structure within the chest cavity can potentially give you pain. So it can be coming from the food pipe system, could be coming from the chest wall, could be coming from the lung covering. So there are many causes of chest pain. The reason why we sit and ask specifics about the character of your pain, duration of your pain, and other specifics is to try and tease out what exactly could be causing this pain. Where is it coming from? So heart-related pain, duration lasts a bit longer. Typically would feel like something sitting on your chest or chest heaviness. The other characteristics we look for are, is it triggered when you try to demand the heart to do more? So this is on activity. And then is it relieved when you sit down? And then you also look for other things like, does it travel to the arm? Does it travel to the neck or the jaw? Do you have other associated symptoms like sweating or nausea? So chest pain is one of the most important symptoms that we look for. The other is shortness of breath. So again, you should not be able to be aware that you're breathing. So if you're feeling like you're struggling to get air in and out, it sort of also prompts
while
us
at
to
rest.
think.
I mean, you've not gone up a flight of stairs or something like that. Okay.
While at rest.
Okay.
We never want it to get to while you're at rest, because that signifies it's a bit more advanced. So when it's beginning, it would be triggered on activity. But as it continues to worsen, you actually do get shortness of breath at rest. Then, the other symptoms such as passing out, so that could also be related to a heart condition, specifically an electrical issue or a problem with blood leaving the heart. The other things that would also... But those are the top three that I would be thinking of if I'm looking for an abnormality within the heart system.
So, heart attack, cardiac arrest, is it the same thing? Are we confusing things? How are they related? And can one cause the other?
Okay. So the easiest way to think about that would be to look at the different structures within the heart.
Yes.
So a heart attack is a plumbing problem. So the blood vessels. So if they're blocked or narrowed, then that causes a heart attack. Cardiac arrest, in simple ways, think about it as an electrical problem. So if you have this pacemaker just completely shutting down, the heart just stops because there's nothing which is telling it it's time to pump. There's nothing that's telling the muscles that you need to squeeze. So if you think of it in those terms, it's very easy, to sort of understand what is what. A heart attack can cause a cardiac arrest. It's one of the many causes of cardiac arrest, but the two are not exactly the same. Yeah.
So what would be the symptoms for cardiac arrest?
Cardiac arrest, your heart arrests.
Just stops.
It just stops. And because your brain is not getting any perfusion, you automatically lose consciousness.
Can it come back on its own?
Yeah.
Can it come back?
On its own? Because somebody had a heart attack, but then the heart starts beating without manual manipulation. Can it come back? Kind of like reboot?
It can with support. So this cardiopulmonary resuscitation, which I encourage everybody to learn, even if it's at the most basic level, it can come back. Meaning it can be revived, or can it occur again? What is the exact question?
So I mean, you would assume that if cardiac arrest, your heart stops, and for all intents and purposes, you're gonna, right? Yeah. But then with the manipulation, it can come back.
Correct,
or does it have to have manipulation to come back, or can you just start again?
Yeah.
I think it depends on the cause.
Okay.
Usually not. You would need to have some form of resuscitation.
Okay.
Yeah.
All right.
Yeah.
I know we're talking largely around heart attack and cardiac arrest, but then, matters to do with the heart. And you've mentioned electricity a number of times, and it might sound like a really ridiculous question. But there's some folks that when you touch them, they shock you. It doesn't matter what they do. There always seems to be some kind of... Does that have any kind of relation with the heart?
No.
Okay, it doesn't.
No, it doesn't.
They're just weird.
Yeah,
those
yeah,
people.
it doesn't.
Okay, all right.
The static.
The static, that thing.
Has
Because
nothing
you
to do
mentioned
with the
electricity, I wondered if it had anything to do with that.
No,
Okay.
No, it doesn't.
All right, they're wired differently,
Yes.
those ones.
Yeah.
Okay.
Good way to put it.
Okay. So, when you mentioned also the athletes, and we've had too many stories. I mean, there's a famous football player who just, I think last year, again, and there have been many stories like that, where healthy guy, you would imagine, is exercising, eating properly, all of this, and then passes out and dies.
Yeah.
And then we've seen, there was another one that happened here in a school, in a high school here in Nairobi. I mean, I think we've seen them all over the world. And somebody who would be a perfect picture of health, then their heart stops.
Yeah.
What happens here?
That's I honestly don't know, because usually these athletes, they always get checkups. They always have to have a medical, I think it's annually or biannually, to make sure that they're fit. So a lot of these athletes, what we've discovered is they do have underlying heart conditions, which maybe are not, said out there. They get treatment, but unfortunately things take a turn for the worse, and this ends up happening. So the specific heart condition that we've seen happens is hypertrophic cardiomyopathy, which is that thickening of the heart muscle, which predisposes people to either heart failure or cardiac arrest because of usually electrical issues. So there are other underlying conditions which sometimes you can test extensively and not pick up. So you remember the EKG we talked about? So when you look at the waveforms and the intervals, there's what's normal and there's what's abnormal. So sometimes you might find that they have a shortened area. Some people have a longer area, and that's not picked up. And that can also sort of trigger some of these sudden cardiac arrests that are reported. But many times for athletes, there's an underlying issue. It's just ignored.
Well, Dr. you say in your practice that prevention is better than cure.
Yeah.
And unfortunately, matters of the heart, by the time someone is coming to your attention, the situation is critical because already there is an existing condition. But are there things that one would do, maybe at home or generally in matters of general health, to be able to observe good health of the heart, if I can say? Could it be diet, or what are some of the do it yourself, as a person, the activities that one would engage in to increase the health of their heart? And also, in terms of wanting to know whether I have a problem, where do I do in terms of an ECG or EKG to come for a test? Would that be a good indicator to say that, yes, you're borderline or you need to do this and that? But what would be the best living standards of practice for me to have a healthy, functional heart and minimize the chances of requiring to come and see you?
Okay.
Yes.
I love that question. So it's very basic, just when it comes to lifestyle, that's the first thing.
Yeah.
Diet starts in the kitchen, what you're eating. So you have to be, like I like giving this analogy, like for women, when you're starting complementary feeding for children, you're very obsessive about what are the nutrients that are in this food. What am I varying it enough? Am I making sure I'm giving enough iron? We sort of lose that as we get older. We shouldn't. So it starts in the kitchen. You need to be aware that food is health. So if you're not eating well, and it sounds so obvious, but we don't really practice it. So if I'm eating badly, 10, 15, 20 years from now, don't think that these things will run away from you. They'll catch up with you. So starts in the kitchen. When it comes to other lifestyle activities, you have to be active. So this is not just for your cardiovascular health, it's also for, longevity, and it's also for your aftercare when you're much older. You don't want to be dependent on people. So you have to be active. Previously, we would say, try and exercise 3 times a week, but not, you're alive 7 days a week. Why are you exercising half that time? You should exercise every day. And you don't have to complicate it. So if you're the sort of person who does walks, try and make sure you've done at least an hour every day. If you prefer to do something a little bit more intense over a shorter period of time, that's fine. Just do something, do anything. Try and avoid sitting for too long. I was sitting outside and I loved what you guys did, at the end of the hour, where you stood up, stretched, took a few photos. I love that. So you have to be, doing things like that actively. We have scenarios where people just sit for 8 hours straight, which is crazy. Yeah, so you've all heard that sitting is the new smoking, and it's true. It's causing a lot of problems. The other things are pretty obvious, but people still, indulge here and there. So smoking is a no. Yeah, it has no benefit. The others are alcohol in whatever quantity. So that's a no. If it's a celebratory drink or two, that's fine. But alcohol has no benefits whatsoever to your body. So if you can stop that, just stop. The other things are, sort of take care of your mental health. Yeah, that also plays a big role in your overall health, and ultimately also helps ending up affecting your heart in a positive way. Yeah.
It's a good thing that Joe and I decided to be walking a lot.
Okay.
It's really important.
I like that.
Yeah. But here's a question where one of the symptoms, because most of the time, especially in the generation we live in, is heart attack, Google your symptoms, right? And a lot would come in. And there is a question where someone finds they're unable to breathe whenever they walk, right? You find that there is that slight pain, but because I had Dr. say if it's a slight pain, you're good to go. Perhaps it's not something big. There is the culture of assuming. There is also the culture that, especially as men, our health-seeking behavior is not so good. Which then leads to individuals finding themselves later with a heart that is not working very well because they assumed a lot, engaged in things that they ought not to. As we have this conversation then, how do we change that story to be a story where I don't just come in when I'm on the deathbed. I come in before, seek advice, and I'm told what to do.
Yeah. Okay, prevention. So, honestly, you're in charge of your health. We're just custodians or caretakers. It has to start with you. Your mindset has to change. So if you want, to be well, just you already know what you need to do. So some people fear coming for checkups because first they say, I feel fine, but, you could have high blood pressure. That's, you don't feel any symptoms, and it's slowly causing destruction. So you need to come for checkups once a year. If you're having issues with, funding and financing and things like that, government facilities are excellent. You'll always get specialists. It'll take time. You can wait, but you'll be taken good care of. So there's no excuse. Kenya has one of the best health systems in the world. So our health seeking...
Our Kenya.
in Africa.
Okay.
In fact, I'm telling you, like, part of our training is done in Canada. They hear you're from Kenya. Oh, it stops. Oh, she's from Kenya. He's from Kenya. We are well regarded. Our training is very good. There are other factors or other things, in the background going on, but we have very good practitioners in Kenya. So it has to start with you changing your mindset, you thinking of health, love yourself also. Yeah, because we end up doing a lot of other things for others, our families, our friends. What about yourself? You have to love yourself. You have to put yourself first. You have to change your mindset. You have to come for your checkups. That's the only way that you'll help protect yourself from ending up in a situation where, things are dire and, we're sort of trying to wonder where we'll get an artificial heart for you. We never wanted to get there. Yeah.
There's a question here. It's asking about in relation to women and childbirth, reproductive system. We often hear things like, preeclampsia during pregnancy, and then the compromise of the heart when that time comes on. What's the relation between then and does it go away? When the baby is born, these things disappear, and then are they avoidable?
So preeclampsia comes in, it's basically elevation of your blood pressure during pregnancy. So the blood pressure, if it's markedly elevated and it's not well controlled, it'll end up affecting, your heart. So many times preeclampsia will disappear after you've delivered, after the placenta, which causes most of the issues, has been removed. But what we've seen is the blood pressure can remain in some patients. You really can't, we don't have a way of predicting who will have this blood pressure becoming sustained for their lifetime or who will have this cured. But it can persist in some patients, and in others it just disappears. But with subsequent pregnancies, with the same partner, there's a risk that it can, keep reoccurring. And if it's not managed well, I think it can cause lots of problems. Yeah.
So you didn't have the thing before. This baby comes along, the pregnancy, and then now you have it. Then so essentially you're seeing yourself being on medication essentially for the rest of life if it stays.
If it stays correct. Yeah.
Okay.
Yeah.
What are some of the other heart issues that we see that perhaps, and again, heart disease is one of the big non-communicable diseases that Kenya faces. Interestingly, in some regions of the country, this is when there was what do we call a mapping of disease in the country. There were certain parts of the country that were more prone to some of these non-communicables in terms of heart disease. What are some factors or indicators that would lead towards some of these things? And is there something that folks can watch out for?
Okay. So from the western part, what we've seen is people have a genetic predisposition to abnormal heart muscle issues. So they get heart failure. It's something called dilated cardiomyopathy. We don't understand the mechanisms. We do have genes that have been mapped that explain what happens or what goes wrong within the muscles. So the key would be if one family member has been detected to have this, then the rest of the family, you do a family tree, you have to map it out, monitor them, watch out for symptoms. The other thing that we've seen in rural urban areas, because before non-communicable diseases, things like high cholesterol, hypertension would only be seen in urban areas, but we're also seeing it in the rural areas. So we're having people have problems related to the heart, so specifically blockages within the arteries, and because they present with pain, they're treated as pneumonia. So I think the awareness is being created that you need to think further. These problems are not, just in Nairobi. We're seeing them in other parts of Kenya, even in the rural areas, given the way the lifestyle has changed. The other thing that we also see is dilatation of the aorta. So in normal scenarios, you should have a normal-sized aorta that is supposed to function properly. But in some people, again, because of a genetic predisposition, they get this aorta becoming dilated and causing problems.
Please remind us what the aorta is. We might think it's a distant cousin.
Oh, okay. So the aorta is a big blood vessel that blood is ejected into by the heart. So that's the big blood vessel that then goes dividing into smaller branches that then supply the rest of the body. So that's what the aorta is. So you can have a dilated aorta, and that can predispose to sudden tear, which can have devastating consequences. So again, if someone has symptoms, they must be checked. If one family member is found to have this issue, they must be screened. One of the other common heart condition that is found in developing parts of the world is rheumatic heart disease. So this is a condition where someone gets a sore throat, and then the kind of response of the body to this sore throat, or trying to clear this bacteria that has caused a sore throat, is abnormal because it detects the heart as having proteins that are similar to what is on the bacteria. So the heart ends up getting affected and treated like it's a foreign organism, and it gets damaged in the process. So what we see is that the valves, which are the gates that separate the different chambers, then become abnormal. They're not able to either close the way they should, or they're not able to open the way they should. It's very common, but there's lots of work going on to try and take care of this problem from where people are most affected, which is in childhood to teenagehood. So yeah, those are the most common things that we're seeing.
So the aorta would be the inflow in plumbing.
Correct.
Okay.
Yeah. Yes. Yeah. Well done.
A lot of cases have come up over time where you hear somebody had a diagnosis of pneumonia or some respiratory, condition, and after some treatment, it turns out it was actually a misdiagnosis. What they had was either the onset of a heart condition. And perhaps that would be one of the reasons that we have now complications arising way too much later before they can be, where they would have been managed easily, but it doesn't happen because of misdiagnosis. So in terms of practice, I understand and I agree we have the best practitioners. I think the issues behind the practice in terms of facility and systems is what fails. But how does misdiagnosis play when it comes to treatment of the heart conditions? What's the prevalence? Or what are the challenges even in your practice when it comes to actually getting the diagnosis correct so that you know what treatment to employ?
The heart is not like the liver. It doesn't regenerate. If, you don't make the right call, it can have devastating consequences. So we do not want misdiagnosis when it comes to heart conditions. We take it very seriously. So we have a lot of programs that try and educate people, from clinical officers to nursing staff, to make sure that they, for example, can detect when a heart attack is happening. So about 15 years, when I was still in medical school, 15 years ago, we didn't even know what heart attacks were. Like, that's how bad it was. But the system has, completely changed. So people are more aware. We never want misdiagnosis. If you're not sure, just call, pick up the phone. There's always a channel that you can use to try and help make a decision or a diagnosis. When it comes to medical schools, we're also a bit obsessive about the kind of training that they're getting to make sure that they're getting the right information to be able to make the correct diagnosis. So it can have devastating consequences. It wouldn't give you a second chance. So we do not want misdiagnosis.
So, Doc, there is this thing called a pacemaker. The only place I've had pacemakers is two. On a truck when people are running, or a set book. What makes it... I'm just trying to bring the point home, yeah? So what are the situations where one is forced to have a pacemaker?
Okay.
And when they do, because I remember there is my fellow classmate had a pacemaker, and there's some places they couldn't go, like through an X-ray machine, security installations and whatnot, because of that. Because many have found themselves having a difficult time with security agencies in the country because they say, I can't go through that because I have a pacemaker, and they don't understand. So just bring us up to speed on why one might need a pacemaker and how the society should start educating themselves on matters to do with pacemakers.
And is it the same with a bypass?
No, those are completely different things. So a pacemaker is an artificial way of making sure that the heart continues to beat. So it's like replacing the electrical system
Okay.
if your own intrinsic or underlying electrical system has an issue. So a pacemaker then comes to take over that function. So this is an artificial device that has two components. It has the battery or a generator, and it has wires, or we call them leads, that are then attached on one end to the generator or the battery, and then the other end sits in the right-sided chambers of the heart. And their work is to sit, detect when it's time to trigger a stimulus so that the heart can beat, and then not beat. So it, quiets. So a pacemaker is supposed to return that function if your own electrical system has an issue. And the reason why your electrical system would have an issue would be if it's very slow, usually when it's very slow. So it's not effective enough. So you need an assisted way to make it go back to working. There are many different types of pacemakers. You can either have one lead, two leads. There are other advanced or more sophisticated ones that have come into the market. And there are even leadless ones nowadays that, we can also place in one of the chambers that, works just as well as the ones with the leads. The pacemaker has evolved over decades.
Yeah.
So previously we would have pacemakers that were very, they were not magnet safe, but the ones we have now are. And we can even do cardiac MRIs very safely, even if you have a pacemaker seated within you. It's very unfortunate about your friend. Any patient who has a pacemaker has to have a card that shows that they have a medical device implanted in them with a specific serial number, and that's what they should use. If that, if he's still struggling, then he should also always carry a letter, whether in his email or a hard copy, to explain what is going on, and that should be able to give him clearance.
Does the battery ever go out? And if it does go out, does
does.
it mean you need to be opened up for replacement?
Yes, it does, but that's a simpler procedure compared to the implantation.
Okay.
So they usually average, depending on how much the pacemaker is being used. If you use it more frequently, meaning you completely have no underlying intrinsic rhythm, then you're talking about 10 to 12 years. But if it's used less frequently, then the life of the battery is 12 to 15 years. Yeah.
So on that bypass issue, we've heard it when we've seen it in the movies. You hear the doctors doing it. We're going to have to do a triple bypass. And what happens here and that surgery taking place is not a heart transplant. Something else is going on.
Yes.
And there's a condition that requires that intervention. What is that?
So the condition is blockages in the arteries of the heart.
Okay.
So when you have multiple blockages, or when you have a blockage in one of the main or bigger vessels of the heart, then there's kind of intervention to unblock them. What has been shown to be more effective is bypass. So that means you crack open the chest, access the heart, and then you get vessels from a different part of the body and bypass the blocked area. So you attach this new vessel from, you attach it to, it had normal blood supply, you attach it to an area of the blocked heart artery that is normal. So you bypass the blocked area and then you attach this new vessel to an area that is beyond the blockage. So that's what a bypass is. Yeah.
And where are you getting this other vessel from? Where are the most viable places to get?
We have the chest wall vessels. So there's one called the lima that just sits within the chest wall cavity. So that's the one that we use. And then you can also harvest the veins from the legs.
Yeah, I've seen the
come
legs.
and
I'm wondering, when you harvest them, you actually remove them from the
Yes.
legs and bring them up here.
Correct, yeah.
Ah,
Yeah,
okay.
yeah.
We
So
have
does that
spare
affect?
veins.
Yeah, you
Yeah.
have spare veins in your
Yes.
legs.
Not really spare, but you can do without them. I mean, the heart needs to work.
Ah,
Yeah.
okay.
Yeah.
And so after that, so what happens to the blocked artery? You remove it, or it just kind of hangs out in there?
It stays there because the blockage will be in one or two specific areas, and because you've bypassed that blocked area and you're supplying normal flow to an area that is normal within the diseased vessel, you've just completely bypassed. It's a small area that you're bypassing, and then you
Okay.
restore blood to the normal area, and it then continues to supply blood to the rest of the heart.
What causes this blockage?
Blockage is many times a cholesterol problem.
Okay.
Yeah, so you have underlying issues, high blood pressure, diabetes, high cholesterol, you're obese. So all these play a role in, affecting the structure of the arterial wall or the blood vessel wall, and that causes deposition of cholesterol within the walls. And because that's not a normal process, it starts encroaching on the lumen or the usual passageway of where blood would flow. So when that's encroached upon, then now you get trouble with blood getting to where it should get.
And how do you know? What's the physical manifestation of that internal problem?
Chest pain.
Okay.
Yeah, chest pain.
So let's demystify it, Dr. Because you see, like you said, 15 years ago, there was no way of telling about a cardiac arrest coming.
It was there. It was just not
very prominent. Today, should we all expect to have heart conditions as we age? Or is it possible for Dennis and I to get to 101 years of, do included? We are not excluding.
I'm forever young.
Okay. To get to 101 and still have a healthy, of course, age-related, healthy and functional heart. Or must we expect to have heart conditions as we age?
Absolutely not.
Okay.
We don't want that to happen. Yeah, and that's why prevention, which you brought up, is key.
Yeah.
So we're here if, Batimbaya, that happens.
Yeah.
But ultimately, we do not want people to go in that direction.
Okay.
Yeah, we want you to, be fine.
And you can.
Long and healthy.
So
and you
it
can. And you can.
Because a dentist once told me that we all should, at whatever age, old age you die, you should have your teeth intact if they are well taken care of. It's the same applies for the heart.
It should be. It should be.
Now, another myth, I don't know whether it's a myth or so, modern practice that is beginning to exhibit that there are some dogs, if trained, dogs. Yes.
Nkita, dog.
Yes.
Okay.
Yes.
All right.
They can aid the practitioner in detecting a heart attack or cardiac arrest. I don't know which is which. But how is that? Is that a practice? Is that true, or is it just a fiction?
Interesting. I've only had it for cancer.
Yeah.
Yeah, that they can sniff out, cancerous cells.
Yeah.
I've not heard about it with heart disease.
Okay.
Yeah.
Okay.
Yeah.
Please train Bosco.
Yes.
So, but now we talk about the heart, right? And in instances where someone's suffering cardiac arrest and needs the assistance for it to come back, right? You find that in the society, pretty much what I've seen is when someone falls, what we do is swanga, and let's just give them air. What I'm trying to say is the society, the community, does not know what to do. Someone might fall, needs that assistance for them to come back, but we do not know what to do because the information is not there.
Yeah.
How critical is it then for us to start looking deeper into this and intentionally, even if it's in primary school, high school, train individuals who at the call of time when they're needed the most, they're able to offer these services? Because there are many who die because that emergency assistance was not given to them when they needed it the most. Is it a conversation that is worth having at this time?
Absolutely. It's definitely a conversation we need to have. It's life-saving. Yeah, if you know the steps to take, you can actually, save someone's life. So I know there's a country in Western Europe that has adopted this mass or nationwide program where they've taught people basic life support, including how to handle something called a defibrillator. That gadget that's attached to the chest that's supposed to jumpstart your heart. So it's definitely a conversation that we need to have. How it needs to happen, though, would be at a national level. Okay. There are also agencies that I'm sure are willing and ready to support. I think there's an Emergency Society of Kenya that is doing that on a county level, but in the county hospitals. But you see, that's not out in the community. Yes. And it's very easy. It's not difficult. It's easy to know how to detect when someone needs help. So, for example, if someone falls in the street, the first thing you need to do is shout for help. Yes. Anybody who is an expert needs to come, and they need to come now. The next thing you need to do is to check, does this person have a pulse or not? And the best place to check for a pulse is in the neck area, not in the hand. The next thing you need to check for is this person breathing? If they're not, just start cardiac compressions. And if you have something that you can use to also sort of give breaths, but the first is restart the heart. So you start cardiac compressions. That person who, maybe in the vicinity, who is an expert, should now be able to come over and start. It's a conversation we need to have. Yeah.
And demystify, is fainting heart related?
It can be.
It can be.
It can be.
But not always.
Not always, yeah. There are other causes of fainting.